Being prepared for a public health emergency takes practice, and Clackamas County is dedicated to making sure its communities are prepared by hosting a 2-day training on advanced disaster life support at Tualatin Valley Fire and Rescue.
This training is unusual within Oregon. We offer it only about once a year, and to host it, you have to meet a lot of requirements in terms of space and commitment, and a little bit of financial commitment as well. So we put out a call for applications, and Clackamas County stepped up and asked to be able to host it, and they have the facilities and the right partnerships to pull it off. So we're happy to have it here in Clackamas County, and we've drawn people from all over Oregon to come to this training.
These courses were for the Clackamas County Medical Reserve Corps unit, a unit that is administered by Clackamas County Public Health in partnership with the Clackamas County Emergency Management Department.
The Medical Reserve Corps is actually a national network of volunteer units formed around the country to help respond to community disasters and emergencies. It's mostly formed of licensed healthcare providers like doctors, nurses, EMTs, and other non-medical folks with technical skills that want to come together and help deal with emergencies in their community.
The first day of the course taught participants how to set up triage sites.
We teach everything from how to do triage for patients in a mass casualty incident. So if there was an earthquake or plane crash, anything like that, they would know how to go in and touch patients and triage them appropriately. They learn how to work in an emergency operations center, so if they help with the command level staffing, they can do that. We also teach them specifics about different kinds of incidents, whether a chemical release would happen, even nuclear incidents we talk about, along with generic stuff like natural disasters, tsunamis, earthquakes, building collapses, all those things of how to respond and how to treat patients safely and save the most lives possible.
The second day of the course, students partook in a mock event with actors that were moulaged with various degrees of physical injury and emotional trauma from the incident. These mock events are an important way for volunteers to practice their skills while reacting and responding under stress and pressure.
We're at the scene of a possible explosion. Okay? There's already been one bomb found here at the explosion. It's been neutralized by EOD, and we'll talk to them very soon.
Having these trainings provided to our local Medical Reserve Corps unit will be essential in the face of a public health emergency, as the Clackamas County unit would be used to supplement existing emergency services.
I think for the volunteers that want to come out and help with the disasters, it's very valuable. Many of them have never had the opportunity to go through this type of training. They don't know how, aren't familiar with triage techniques to do for multiple casualties. So we provide them with that opportunity, and they actually get hands-on practice to actually know what to do when they respond to a disaster situation in the area.
And if something major, catastrophic happened, a lot of the emergency services would be going into the Portland metro area. And a lot of people in rural environments are going to need to be able to take care of themselves and their family and their neighbors and their grandparents. And so I think especially for us, it's very important that we're prepared.
If you're a licensed or certified medical health professional, emergency preparedness will be crucial to the county in the face of an emergency. Get involved and be prepared. You too can volunteer and join the Medical Reserve Corps unit.